Hi, I'm Histamina Dawa, and I'm going to present a case report about histamine poisoning. 35-year-old male arrived in the emergency complaining of having palpitations, headache, heat all over the body, and the presence of redness, especially on his face, along with eyelid edema. The vital parameters showed marked hypertension and tachycardia. The initial treatment was as follows. First, hydration with a ringer lactate, then administration of methylprednisolone 2 grams and the chlorpheniramine maleate 10 milligrams. During his stay in the emergency room, the clinical conditions of the patient did not improve. The patient was transferred by ambulance to intensive care unit where he arrived 3 hours after having fish meal. He arrived conscious and cooperative. During the clinical checkup, the patient began to have chest pain. Immediately after the administration of 50 milligrams of ranitidine intravenously, an immediate remission occurred. Both of the arrhythmia and the chest pain disappeared as well. The patient stayed under observation in intensive care for the next 12 hours. The treatment was carried out as follows. 150 milligrams of ranitidine as a continuous infusion for 12 hours. Chlorpheniramine maleate 10 milligrams IM and ringer lactate 1000 milliliter. Glucose 5% solution 1000 milliliter and saline solution 0.9% 1000 milliliter. Subsequently, he was transferred to the Department of Emergency Medicine, where he remained inpatient for another 24 hours, then discharged. Histamine poisoning is allergy-like poisoning known as the Scromboyed Syndrome. It is a result of ingestion of poorly handled and contaminated fish that belongs to the Scromboidae family like tuna, mackerel, and bonito. However, it could be caused as well by other kind of fish or cheese rich with histidine. When raw fish is inadequately stored in temperatures above 16 degrees Celsius, bacterial activity will cause the free histidine to undergo an enzymatic conversion by decarboxylation of the amino acid histidine into the primary amine histamine. This process will result in high level of histamine to be present in the meat. Histamine is a messenger molecule. It's not considered to be a natural toxin per se. It is released from mast cells in the tissue and basophils in the blood. Several functions of histamine are mediated by histamine receptors H1, H2, H3, and H4. Histamine is the main natural chemical responsible for true allergic reactions, so the symptoms produced are almost identical to a food allergy. Symptoms typically occur within the range of 10 to 30 minutes up to 3 hours after ingesting contaminated fish. Symptoms are generally self-limited. Intoxication occurs even if the contaminated fish is cooked. Poisoning with a histamine either can be mild, moderate, or severe. First signs of poisoning may be mistaken to allergic reaction, typically with these symptoms: facial flushing and sweating, burning peppery taste sensation in the mouth and throats, dizziness, nausea, headache, tachycardia, and cold-like symptoms. On the skin level, we might notice rash, urticaria, localized swelling, and erythema. On the gastrointestinal apparatus, we might notice nausea, vomiting, diarrhea, and cramping. Hypotension or hypertension might be present. Tachycardia and palpitations, headache, tingling, feeling of warmth around the mouth, and loss of sight in some cases. Bronchoconstriction and respiratory distress in more severe cases. Diagnosis of histamine intoxication is based mainly on the onset of symptoms immediately after food ingestion, typically with symptoms starting within the range of 10 minutes up to 3 hours after eating the food. Diagnosis may be confirmed by examining the food remnants to detect the presence of high levels of histamine. Differential diagnosis between histamine poisoning and food allergy could be established by the lack of allergy history. The detection of unusually high levels of histamine in ingested food, as well as the contamination in group outbreak. The treatment in mild cases, it may not be necessary. Only observation and monitoring may be sufficient, as the illness is self-limiting in most cases. In moderate cases, the administration of antihistamines is still the gold standard therapy for histamine intoxication. Usually, it helps to ease the symptoms promptly. H1 antagonists are usually chosen to treat histamine poisoning. H2 antagonists may be equally effective. In severe cases, antihistamines are given intravenously. In case of edema in the respiratory tract, hypertension, and bronchospasm, epinephrine, corticosteroids, and beta agonists might be used. Poisoning can be serious, even fatal, if not treated on time. Histamine has many physiological actions, such as a mediator that increases vascular permeability, which causes runny nose or watery eyes, mucus secretion, gastric acid secretion, wound healing, angiogenesis, immunomodulation, day-night rhythm, allergic response, drop in blood pressure. These many vital functions have many implications on the mechanistic aspects of histamine poisoning and its treatment. Some of the symptoms of histamine intoxication are a direct result of histamine action on the cardiovascular system, such as vasodilation, hypotension, flushing face, and headache. It increases capillary permeability and causes the loss of plasma in capillary endothelium, leading to symptoms like urticaria and edema. Histamine increases heart contractility, rate and strength of contractions. This might count for palpitations in histamine poisoned individuals. Histamine causes contractions of extravascular smooth muscles. In histamine poisoning, this causes abdominal cramps, diarrhea, and vomiting. Histamine regulates gastric acid secretion. It's a stimulant of sensory and motor neurons. Histamine is released mainly from the mast cells in the tissue and basophils in the blood. Intestinal and bronchial smooth muscles contain mainly H1 receptors, while H2 receptors mediate gastric secretion. Oral ingestion of pure histamine does not cause any systemic effect, as it is inactivated in the intestine prior to passing the portal circulation. Some theories were presented in an attempt to explain the massive resorption of histamine and the dose response in histamine poisoning. One assumption was the presence of enhancers. Thiamine might be playing a role in allowing the passage of histamine from the intestinal wall into circulation. The response to histamine intoxication is mediated by histamine and its receptors, which will cause vasodilation, alteration in blood pressure, smooth muscle contraction, tachycardia, and stimulation of nociceptive nerve fibers. Diamine oxidase, DAO, and histamine N methyltransferase, HNMT, are the enzymes responsible for metabolizing histamine. DAO is the major enzyme in histamine catabolism. It is responsible for scavenging extracellular histamine. Liver and small intestine are rich in histamine metabolizing enzymes. These tissues have a primary role in catabolizing ingested histamine. Histamine toxicity can be potentiated by the inhibition of DAO and HNMT enzymes. Orally administered histamine is exerted in the urine in the form of histamine metabolites. Proper handling and cooling of the captured fish until its consumption is essential to avoid meat degradation and consequent histidine conversion into histamine. Diagnosis of histamine poisoning is based on clinical history and symptoms. Treatment with antihistamines is efficient for most cases. Thank you for listening.